We're moving right now to the heart of equity and prevention and care, which is parents and families. So I am very honored to introduce our panelists and invite you to please come up now, if you would be able to. So I am introducing Heleine Wolfgramm, who is the mother of Makalani Wolfgramm, Ashley Hone, who is the mother of Kingston Ryan Hone, Guadaloupe Aguilera, who is the aunt of Sophia and the sister of Maria, Celeste and Keisha Namba, who are the mothers of Koji, and Stacey Fletcher, who is the mother of Benjamin.
Can't say enough about these amazing people who are here to speak. So I want to give them all the time that we have possible. And so please ask me to start and share your stories.
Okay, I'm Ashley. I'm so grateful that I get to be here today. I'm going to try really hard to stay composed, but I'm going to talk to you guys about a very sensitive topic. It's already starting. Okay. Thank you. First of all, I work as a bereavement support specialist at one of the healthcare organizations here in Utah. I get to cover 4 different hospitals in Utah County. And I'm going to kind of tell you how it started, how I got into this line of work. So my story starts back in 2009. My husband and I were told we would never conceive naturally. So we went ahead and did in vitro. We got 2 embryos. We transferred both of them. By the grace of God, they both stuck. We were pregnant with twins, right? We were living this beautiful American dream. It was perfect until it wasn't. We went in for our 20-week ultrasound. We found out we were having a little boy and a little girl. But we also noticed that our little boy had some severe anomalies. So we got to maternal fetal medicine. We did the amniocentesis and it was confirmed that he had trisomy 18. If you're familiar with that, it is a diagnosis that is considered incompatible with life. Obviously, we weren't going to terminate our pregnancy. We had a very healthy little girl still inside. We wanted to give her the best possible chance of a healthy life. So I carried to 33 weeks and my body just decided it was done. I ended up going into labor. My husband was not there. And so I'm trying to call him on the phone to get him to the hospital as soon as he can, trying to decide if I'm going to deliver vaginally or cesarean, just trying to make all these decisions so quickly. And again, by the grace of God, my husband made it there in time. We chose to do a C-section, which ended up being the right choice for the circumstances. Both of our babies were born alive. We felt so grateful. But we had spent the last 13 weeks watching our son Kingston slowly decline. And so we knew that the right choice was to not intervene. And so we did just let him pass away peacefully. He lived for 73 minutes. Really hard to have a lifetime of love in just 73 minutes. But we're so grateful that we got that because I know not everybody is so lucky. So through all of this, I was able to work with the Angel Watch program, which is here in Utah. It was a social worker and a nurse, and they would come to my house every month and talk about how do you want to plan your funeral? What do you want to do? What's important to you at the hospital? What's important after birth? And so I had made a list of everything that I felt was important. It was so simple, the simple mundane things that we take for granted. Putting a diaper on my child, dressing him, and giving him a bath were at the top of my list. I wanted to be his mom. Sorry. So through the Angel Watch program, not only did they help me make this list of what I needed and wanted, they were there in the hospital when I delivered my babies. They were there with a camera, they took photos, they documented everything. They made hand and foot molds for us, they did prints, they brought the clothes. Kingston was born at 2 pounds, 2 ounces. There are no clothes made for a 2-pound baby. They had everything I needed that I didn't know I needed. It was so monumental to my healing that it shaped the trajectory of my life. It led me to where I am today. I knew from that experience that I needed to give back. I needed to be in the hospital when parents gave birth or shortly after so that I could provide that same peer-to-peer support. I wanted to be that advocate for those parents. I wanted to be the voice when they couldn't speak up. I can go in with a clear head, just like somebody did for me. That was important. So that is what I do. That's how I got into this line of work, is working for a bereavement support specialist. I get to share these most intimate parts of these families' lives with them. I will never take that for granted. But some things that I just want to mention that will always be important. Like I said, giving that child dignity, letting those parents parent their child. We don't look at it as products of conception or a fetal demise or tissue. It is their baby. It is their child. And we want to make that important, very important. We will walk in and the first thing I will ask that family is, what is your baby's name? I will refer to their baby by that name the whole time I'm there. I don't want to refer to it as the baby or your baby. I want to refer to them as Benjamin or Koji, whatever their baby's name is. That is so important. It's important that we recognize that they exist, that they have a name. They are important. They're an important part of that family's life. And then just the peer-to-peer support, I feel is so important. We can understand them in a completely different way. We can empathize with them. Like I said, we can go in and we can be their advocate for what they need that they don't know they need. And of course, it's going to be different for everybody. And I'm going to respect their choice and their culture and their beliefs, but that is something I'm continually trying to learn and grow from. And I think I will just keep striving to be better every single day. Thank you.
Thank you.
Again, Mr. Wolfgramm. My family originates from the islands of Guadeloupe, first generation in America. I work for UPIC as a community health worker. My story starts Halloween night after we were done doing the festivities. My water broke. I was 36 weeks. I went into the ER. The nurse was having a hard time finding the heartbeat. She mistaken my heartbeat for his. Living in a small town, this is currently in Vernal, Utah. The nurses were all my friends, played volleyball together. And, I could tell there was something wrong in their faces. They just couldn't tell me. So I had to wait for the doctor to come in and tell me that they couldn't find a heartbeat. And that because I was only 36 weeks along, they'll just let my body naturally push him out. Currently, at the time, my husband was in New Mexico working. We were in the oil field. And so I'd call him and tell him, like, come home. That happened. And then, gratefully, my body didn't go into labor. Gosh, sorry. When I did this panel as a practice, I just was blurting it out, not getting emotional. Sorry. He rushed home, and luckily my body didn't go into active labor until he got there. He later got fired for leaving his job to come be with me, but the rains and pours. I was afraid to hold him by myself. I was afraid to go for labor by myself. So I went to labor. The doctor thought because he was 36 weeks, he'd be small. But I had gestational diabetes. And so he came out 24 inches long and at 11 pounds, 3 ounces. He wasn't able to get him out. First he got me all the way open, and he still couldn't get his shoulders out. So he had to push him back inside me with both arms, break his collarbone, and then pull him out. And when he was pushing him back inside me, that was the worst pain I ever felt in my life. At the time, my shoulders and my neck was hurting so bad because I was shaking so bad. And I was begging the doctor to tell me. I was begging the doctor, like, please knock me out. I can't take this anymore. Please knock me out. The pain was way too much. I never really screamed in pain, and that day I screamed for a long time. He came out, it was silent. I asked if he was okay, even though I knew that he wasn't. Even though he was gone, I still wanted to know if he was okay. But I couldn't really dwell on that thought for too long because I was in so much pain. I did have an epidural, but that wore out quick. I had hemorrhage twice. The doctor that was on call at the hospital that day, he was my doctor for my first baby. And when I was finally able to stop shaking and breathe and not be in so much pain, I looked over to my husband and my sister in the room, and they were both crying. And I was wondering, why are you crying? And then I remembered that it was my son. The doctor on call was so upset. He asked me, why didn't you come to me as your doctor? And at the time, my insurance has changed, so I had to change doctors. And he asked me about my doctor's visits, and he looked at my chart. He said, when you had me in your first pregnancy, I had you on insulin. And your doctor now didn't have you on insulin? I said, no, he only had me on metformin. My friends in the hospital called these angels to come and take photos of him. It's a nonprofit group that came and did photos, hand and feet molds. They had blankets for him and for me. I was in the hospital for a few days to recover. They had stitched me up, and then the morgue came. He said everybody was amazing. Everyone was gentle and kind. But the guy from the morgue had told me, you have to have this funeral fairly quickly because she was deteriorating really fast. I got out of the hospital a few days later, and then a few days later after that, we had to bury him. So a lot had happened so fast, I didn't have time. I only had a few hours to hold him. I didn't have enough time with him. And I wish I had known that, about the cuddle cot where they could keep him cool for a little bit longer so I could hold him longer. I'm just sharing my story to bring up awareness. I wish I knew more how to advocate for myself and do better for my son. I just did what the doctor said because to me he knows better. and I don't want anyone else to go through what I went through. I understand now how important that small window of time I had with my family. I would have done so many things differently. I'm so glad I had friends who knew who to call. You know, and I hope everyone has the same options I had when I went through this. I'm now painfully very aware of how crucial prenatal care is, because when you know better, you do better. And that's all. I really appreciate that I had the time to talk about my son, because talking about him is real in my life, and he really is. Thanks.
Thank you for the opportunity to be here with parents. I'm not a lost parent, but I have a sister and a niece that were stillborn. And so what does this mean? It means that my mom and my living sister both experienced a stillbirth. When I was about 1.5, my mom experienced a stillbirth, and she went on to have 2 other children. Fast forward a couple decades, my young sister lost her first child, but continued on her family building journey with her partner through the ups and downs of parenthood. So echoing some of what we've heard today and at last night's welcome event, my first message today is about this perspective of individuals and families being on a broader fertility journey when they experience a loss. We have a lot of published research that speaks to this point, for example, about the association between miscarriage and stillbirth, maternal health, and health outcomes in subsequent pregnancy. For those with lived experience, statistics do not sufficiently portray what it means to be on a family building journey when pregnancy loss or stillbirth happens. And so to carry that extra mile within our healthcare systems, my first message is about this broader family building journey that individuals and families may experience before and after a loss. When my niece passed, I was in grad school and I was doing various different research assistantships. One on an evaluation study of home visiting programs. And so the natural question came about, why doesn't this exist for lost parents? So for me, this family building journey includes parenting after loss. My second message is about the range of who experiences stillbirth. We're very close within my family of origin, and the losses that have happened are in part what connected us so much over the years, including at an early age. Although they are now citizens and permanent residents, my parents are from another country. So growing up, we had an added layer of relying on each other in ways that are likely common among other families of different nationalities with language barriers. And so when I say that my second point is about the diversity and the range of experiences of stillbirth, this is partly what I have in mind. In published research, stillbirth is sometimes referred to as the silent loss or invisible death, because a loss is both a birth and a death, and as a society, we don't have norms around what to do. Parents often suffer alone, though this has thankfully changed at a rapid pace at least since my mother's loss. I'd like to push us further to be fully aware that people may have added layers of isolation in various realms of their lives. For lost parents that are born outside the US, added layers of isolation could mean the logistics of literally having nobody to take you home from the hospital. In the hospital setting, language barriers may be remedied with support from an interpreter, but so much gets lost in translation in terms of emotion and the ability to process the trauma of a loss. Social isolation could also come from a stigmatized pregnancy, for example, a teen pregnancy or a single mother undergoing IVF, and so on. In partnered losses, social isolation may be experienced differently by each parent. For example, in cases where all the paperwork and clearing the home of the baby's things are left to one parent with the intention of protecting the emotional well-being of the parent that carried the pregnancy. In many cases, parents don't make it through
their family building journey together. As a researcher, I lead a project called Stories of Support After Stillbirth Among Immigrants and Refugees. And the topics I've touched on today are reflected in these stories. I lead this project from the perspective that potential added layers of I lead this project from the perspective that despite potential added layers of social isolation among those born outside the US, people find a way to move forward in their life after experiencing stillbirth. My work is broadly motivated by the experiences in my personal life, but also through my research as a social demographer, where we know that large percentages of all deliveries among some subpopulations in the US occur among the foreign-born. And this is not necessarily about risk, it's just about the numbers, which for me has implications for long-term care. So far, participants' socioeconomic backgrounds are skewed towards English-speaking, higher income, and higher education, including bachelor's, master's, and doctoral degrees. And they tell strong stories of support that exist through this robust network of peer support. However, many are missed by this network. Some preliminary common themes for other sources of support include affiliation with religious or spiritual leaders, casual walks and talks with friends, long-distance conversations with family members in their home countries, and therapy, including connecting with professionals in their home countries. They also described missed opportunities for meaning-making, not always through mementos, but through honoring the birthing process and honoring rituals around death, including burial of the placenta or funeral proceedings in their home countries. And so to wrap up, stillbirth is both a birth and a death. And this part may seem so obvious, but the processing is not. So in sum, my two messages are, first, when a loss happens, there's a broader scope of support to consider throughout the family's family building journey. And my second message is to consider the range of who experiences stillbirth and to work towards flexibility in supporting all different types of families.
Celeste, Namba, this is my Keisha. I'll primarily speak today, but I have Navajo, so I wanted to introduce myself in Navajo. Yat A She Celeste Nambi She Ki Ami Nishne Bish which I Bashish Chin Nanish Teja Tachi Dashiche Ilagana Dashinale. And I just introduced my 4 clans, so traditionally I'm related to Ernest. His 4th clan is Kiani, which is my first clan. Not sure what the relationship is, but probably something like grandpa. So I appreciate this opportunity to have this space. I just wanted to share a little bit about our story. So Keisha and I have known each other for 17 years. I've been a couple for 15 and a half, 16 of those years, and we were only able to get married in 2014. So we'll be celebrating our 10-year anniversary a little bit later this year. Our family building journey started a long time ago, probably 2 years into our marriage, and we were kind of hurdling a lot of different things with family building as a LGBTQ couple, and dealing with fertility issues on top of that. So when in 2018, when we got pregnant with the first time we got pregnant with our son Koji, we were just ecstatic. Things were going really wonderfully. It felt like we were kind of like climbing this mountain of different things that we were trying to navigate in life to build our family. And shortly after kind of announcing it, we felt like we had gotten past the early stages and had finally announced on social media and got a lot of support from our family, friends, people from the LGBT community. I went into early labor, didn't know I was in early labor. And by the time I realized it and we got to the hospital, I was already fully dilated, and Koji was born 4 months early. So he was at just before 23 weeks gestation. And he was born at 1 pound, 3 ounces. And we decided to go through the intervention route and see if we could rescue him. We did receive a lot of support from the healthcare professionals, and but the decision to make it was a very, life altering, our world turned upside down decision. We were able to spend 8 days with him in the NICU, and I just wanted to share some of the things that went really good and what could have gone better for our experience. So I'll start with the bad and end with the good. So the things that could have gone better, sometimes there would be professionals that would come into the space with us being next to our son's isolate, and it always went better when we were asked what our relationship was instead of the assumption being made. When the assumption was made, it was very often the wrong relationship. Sometimes they thought that we were, mother-daughter. It was sometimes really awkward.
Grandma.
We were asking if Keisha was grandma to baby, and so just making that space to allow us to introduce ourselves or not make assumptions would have gone much better in those circumstances. We had to do like different types of paperwork for the birth certificate and things like that. And a lot of the hospital paperwork is specific to heteronormative couples. So it was sometimes hard for us to figure out how to fill out the paperwork. There wasn't really any resources for us to go to see how should we fill this out. Weeks after everything happened, we got a phone call from the hospital asking us like why we chose the options we did, because they didn't understand their form. So Keisha had to be entered on the birth certificate as the father who was not male. And
I had to explain that to the hospital staff what that meant.
And so
I'm like, it's your paperwork, but I have to explain it.
Yeah. So that's something that as a lesbian couple, it would have been easier if someone was there, or if there was like paperwork that was specific to our relationship. The other thing that we kind of ran into that was really difficult to deal with was, after the 8 days of being with him and deciding to stop interventive care, is getting a phone call from a different department in the hospital asking, doing the mom baby check. We had just experienced a loss and got the phone call maybe a few days after. How's mom doing? How's baby doing? And we had to tell them over the phone, sorry, but we were not able to bring our son home. That would be good to have notated in your system so you're not making those calls to us. The things that did go really well were the support and care that we got from the staff. It was truly amazing. They were always making sure that we were taking care of ourselves during that time we were at the hospital. We even had a nurse, advocate for us without us knowing that she wanted us to stay at the hospital so we could be close by. especially when things started to turn for the worse with his health. The other thing was the congratulations that were given to us, even though we were in a tough predicament. That offer of congratulations about your baby, and I know for some families that might not be appropriate, but it really helped to change the perspective that we were in when it was like our world is turned upside down. But there is some joy and happiness in this moment. At the time, we didn't share the same last name. I hadn't changed my name over from my maiden name, so on all the paperwork, our son was under my maiden name. And one of the staff members asked, what is his name going to be? And so when we told them, they made a little name tag with what his last name would be instead of Baby Ludlum. It was Koji Namba. So that was something that was really touching. Just the like little things that they did for us. So, working with the doctors, and they always kept us informed about what was going on with his health before, we decided to stop care. After our loss, the things that went really well is swift intervention from our primary care physician. So instead of asking us to or waiting for 6 weeks for a postpartum checkup, she called and had me schedule it 2 weeks after. And that appointment that I had with her, they did a mental health check, and they were doing everything that they could to support. Another big thing that was really helpful was like family support, peer support. So in the times that we were not feeling like we were getting enough support, we were reaching out to find support groups online. We got connected with an organization in Utah here called Share Parents of Utah, or other lost parents who lost children. And that really helped to bring a sense of like, this isn't just me being targeted, that this loss and grief is happening to me. Like, unfortunately, it's shared by a lot of people, and having that space to share was really important. So yeah, I just wanted to thank everyone for this opportunity. I really appreciate the opening ceremony being a part of this, because it really brings a sense of calm and collectiveness to the moment. I also wanted to thank like healthcare professionals like Dr. Cohen. I'm from the reservation, so I was born in Fort Defiance where you work, and just knowing that we have that support, it's making me realize that if this is something that's prevalent, I haven't connected with other Navajo women who have gone through loss, and it's showing that there's still gaps to be filled. So thank you so much for the work that you do. I also wanted to remind any lost parents that grief is unexpressed love, and as much as you can find works of service to do and find ways to express the love for your child that you no longer have with you, just know that you are doing great. Remind yourself to give yourself grace, because anytime you feel grief, it's that love that you were not able to give to your child. But thank you so much.
These ladies, like, this is why we're here today, right? I mean, we could take their stories and spend the rest of the day coming up with an action plan on how to do this different and going forward. So thank you. I love the diversity of story and all the stories of this group. I mean, I'm an English person, I'm a storyteller, and I love the diversity in this group. And so I want to ask you, I know you covered it a little bit, but you have a room full of clinicians and researchers and parents. Like, if you could give them one piece of advice from your perspective moving forward, just a couple sentences, like, this is what we need to do to be in a better place next year. For people just like you, what would you, or what have you learned being on this panel? Are you ready for one more question? Okay.
One thing that I sincerely appreciate from my provider that delivered my twins was it's been 14 years, and every time I see him, because we're now technically colleagues at the hospital, he'll still refer to me by my name and he still remembers my story. I don't know how, but he has made that a priority and it has meant so much to me. So even if you can remember just a teeny tiny little piece of something, the baby's name, the mom's name, whatever it is, this little tiny piece of their story, it is so healing and so validating. There's something that
Final words of what you want to say to all of people in the room to make it better for other families like us.
That's a loaded question. I think for me, because I was living in a predominantly white area, Vernal, Utah, I think my thing I would like to change is like to try to remove biases if you have it subconsciously or unconsciously. Because at the end of the day, like, those are our babies and they deserve better.
I think being in this space has really gave me a new perspective of, I do come from biracial background, and not growing up traditionally in Navajo culture, I do my best to offer respect for the culture, but I don't necessarily go by the teachings, taboos, or some of the cultural traditions that happen. And so I think there was a question posed earlier that I wanted to kind of address, is that if you're not sure, so do some work to understand the different cultural backgrounds for the populations that you're serving, but then also don't be afraid to ask the people that you're serving, like, how can I support you, or are there traditions that you would like me to follow, things like that, because that would be something that would be really amazing, coming from both Navajo culture and from being in the LGBT community. So.
So a lot of what you said, that to try to honor the birthing process and the requests of the parents, and also rituals around death that the parents might request.
Do we have time for any questions? Does anyone have any questions for? You're not running away. Getting a block in.
I know this is probably not a question for the medical community, but I'm absolutely disturbed that your husband was let go from his job in the middle of all this.
Oh, yeah.
That,
It's fine.
yeah, and
You're right, it's not fine.
I know, but we say that like.
They fired me for asking for time off to bereave for my son. They said, well, we're friendly firing you, but we just can't keep you on. And I'm like, well, just dealing with the loss of my son. And when I came back, they said, well, we're offering you a promotion. Is this going to affect you? Is the loss of your son going to affect you? And I knew the answer was yes, but I had to say, oh no, it's not going to affect you. And because I knew the answer he needed. And it wasn't, yeah, this is going to affect me my whole life. And it might interrupt with my work, but he didn't care. So yeah, they don't care. It doesn't matter.
I don't know how we changed. I mean, that's not a medical issue, maybe more a political issue.
Yeah.
It's like when our baby was stillborn, they gave me we had a 3-day paternity leave. And so it was like, well, but then they give a 5-day bereavement leave. And so I was trying to, it's like, I had to go convince my boss. It's like, well, I've had both a birth and a death. It's like, I need this time. It's like, we're completely messed up. And anyway, I just wanted to tell you, thank you for your stories. And I grieve with you, and I hope everything's okay with your husband.
Oh, yeah.
You know, as well.
That was 11 years ago. It'll be 11 November 2nd. So I'm thinking that my body's remembering trauma, and so it's like, also I was sitting next to her and she was crying. Like the process of being a bus, and so like I think they're just looking for any reason to let go of workers during the bus, and yeah, that was hard planning a funeral with no job. I mean, there's a lot to my story, but we only get 10 minutes.
I just wanted to say thank you as well. I can't imagine how hard it must be to stand, sit in front of all of us and tell your stories about your beautiful babies. And I just wanted to show you and tell you my gratitude, because this is what makes us work hard in the space, is to make a difference to the parents and the babies. Thank you.
Thank you.
Thank you. I just want to say thank you also to all of your stories. And I want to make sure I get this right. Ashley, sorry, the person to your right.
Celeste.
I wondered, so probably like 2 years ago, we were starting to talk about pregnancy after loss clinics. And we know that the spectrum of loss goes from, recurrent infertility issues all the way through to full-term stillbirth. And so the way that you walk through the hospital, you go from like the antepartum unit, right, to labor and delivery. And then you go to the NICU, you walk through another group of doors. And as a mother goes through each one of those doors, she often has to retell her story and educate her care team, because a lot of that critical information seems to not follow through. So I wanted to thank you for the very specific feedback you provided. And secondly, asked you, as you walked through those NICU doors, was your care team in the NICU aware of what you had been going through before you came in at all? How did that work? Question.
I think being in that space for so long, we were there for over a week. As time went on, we were getting the same healthcare team. So if nurses were coming back on shift, they were requesting to work with us again. So because they knew, the Koji's care and how things have changed, and they could monitor if there were health changes for him. But they did really great at understanding our relationship, and it seemed as though, for the most part, new people that they were bringing in to support us were aware of our situation. Every so often, there was a department that would come through, like volunteers, and it was probably mostly volunteers who made the assumptions about what our relationship was and our relationship to Koji. So they did really great. I think the healthcare team did a really good job at that, and I know that it would have been harder if it was us having to re-explain that over and over every time we came into that space. So thank you so much for the question.
I have a question. I think that clinicians often see parents like in their moment of grief in the hospital, and then we just drag you all out to tell these stories again. But my message from these parents, and as a parent myself, I hope that you can see past these stories into what we become and what we grow into, and the power that we have to help in research and in clinical care and in peer support and where we fit in this room. We're just not up here telling sad stories. Like, we need to be embedded in every single person, every single thing that's happening in this room. Take us and embed us, because it's how we heal, right? Mm-hmm. And so I always say, we hear these stories of the parents, but also like, you never get to see sometimes us leaving the hospital and becoming like kick-ass advocates and pushing this forward. So I want really quickly for you to tell us how your story moved on, and good news about your. So will you just briefly say about where you're at?
So we did try to continue our family building,
Both of us.
and biologically we weren't able to carry any more, but we were very, very fortunate to come to the opportunity to adopt a baby. So we've been working with their bio family and an open adoption. Just about, I think she was about 22 weeks along when they chose us, and they were very, very sweet to allow us to come to the ultrasounds, come to the birth, be a part of the birth story. And our son Avit, he did have to go to the NICU, so there was a little bit of trauma in going back to that space, but then we also found a lot of healing. Healthcare team that would remembered us from 5 years prior, remembered where our son, where Koji's bed was in the NICU wing. Just little details that they kept onto that were very healing for us, that knowing that we made a positive impact on their lives. And so we'll be officially adopting Ava at the end of this month.
Floating around here somewhere.
He's so cute. So our surviving twin Scarlett is 14 years old. She's thriving. After the death of our son, my husband was very determined to get a master's degree in anesthesia. So he applied to 2 programs, did not require the GRE, and he got accepted to both of them. So we chose to go to California, and the month that we moved to California, I miraculously got pregnant. So we call him the California miracle. He's 12. And then his first job out of school was in Arizona, and again, I miraculously got pregnant a few years later. So we also have the Arizona miracle. So I have 3 surviving children, and life is great.
Oldest, and my son, the one. And another son, we named him Koloa, and Antonio means treasure. And so, and then I have 2 girls after that. But all my kids know that, like, that boy of mine is like my whole heart. Like, one kid will do one thing, and he'll do the same thing, and he just can do no wrong. But yeah, we have 3 children. After I've had health complications, and so I tend to can't have more kids. If I could have more kids, I would. I love my man I'm with. So in love with him. So in love with my kids. I'm so lucky to be their mom.
And if I could, I would, but I literally not with this body.
Children, five grandchildren, one that is just a handful of days old, so she couldn't be here. She's doing grandma stuff. My sister has two living children, and she's doing mother things. She's off at a soccer tournament, and they're both wonderful people in my life, and grateful to have them and to learn how to love from them. And grateful to be here with all of you.
I can't thank these ladies enough, and I will add, this woman is amazing, and her research now and her postdoc is on the effects of stillbirth on the entire family unit, especially siblings, and so it is such a valuable aspect that we need to look into. So like, she's a hero here. Thank you so much. And by the way, all of these people have said they are ready to share their story and contribute in this community wherever needed. So I can't thank you enough.